Hello everyone, my name is Tsuyoshi Isojima. I'm a pediatric endocrinologist at Department of Pediatrics, Teikyo University School of Medicine in Japan. My research focus is bone and growth, so I have been doing translational research. I'm also an editorial board member of HubLE. Today, I'm here on behalf of HubLE to interview with Dr. Marc Sim, who presented his work and won the Best Clinical Presentation Award at ANZ BMS 2021. Hi, Marc. Could you introduce yourself to HubLE audience?
Hi, Tsuyoshi. My name's Marc Sim. I'm a Senior Research Fellow at Edith Cowan University in Perth, Western Australia. I'm from the Institute of Nutrition Research, which is based out of the Royal Perth Hospital Research Foundation.
Awesome. Okay, so what did you present at the meeting?
So in this particular piece of work, we looked at the relationship of this novel biomarker of muscle, which we call, which is the ratio of creatinine to cystatin C. So to put very simply, we know that creatinine is produced by muscle cells, and cystatin C is basically produced by every cell in the body. So if you want to get an estimate of muscle mass, you look at this ratio, and a higher ratio of creatinine to cystatin C would suggest a greater relative muscle mass, and a lower ratio would suggest a lower relative muscle mass. So now that we've gotten that out of the way, basically we wanted to see whether we can use this ratio and link it to measures of sarcopenia, such as muscle strength, physical function, timed up and go test, or appendicular lean mass adjusted for height squared. And more importantly, we wanted to see whether this ratio could be used to identify women who are at a greater risk of suffering a self-reported fall or injurious fall-related hospitalization.
So that sounds good. I think your result is directly connected to the clinical practices. So, yeah.
Yeah, so what we're basically finding is that this ratio was associated with basically people with a higher ratio had a stronger grip strength. They had a higher appendicular lean mass adjusted for height squared, which was derived from DEXA. And in women with the lowest ratio, or the lowest relative muscle mass, they had up to 50% greater risk for a fall-related hospitalization over 15 years and a self-reported fall as well. So potentially quite a useful tool to identify muscle, and one of its most common outcomes being falls.
That's very good. So what's the key finding of your study?
At the moment, it's still very preliminary data in the sense that we've only looked at it in one cohort. But essentially, what we are proposing is that with a little bit more research and perhaps with some replication in other cohorts as well, we can use this creatinine to cystatin C ratio as a biomarker for sarcopenia and a biomarker for identifying people with greater risk of falling in the future.
Yeah. So that kind of feasible biomarker is very important for clinicians. So yeah, I agree with you. And could you set the limit or set point, or I mean the reference value of reference value?
Yeah. So this is a common question that we got when we were getting the paper reviewed as well. It's still under review. Basically, we were asked to create to come up with a clinical cut point, and we used the Udens index, and we identified a cut point. However, I still think that there needs to be a lot more studies, and there needs to be studies done across multiple ages. In our study, we looked at women at about the age of 70. We need to look at women of younger age, before we start creating reference ranges and cut points as well. So I'm a little bit hesitant to answer a direct cut point now until I have a little bit more data.
Okay, that sounds nice. So what the big picture of your study? I mean, the future study. What are you going to do in terms of this your finding?
This part, yeah. So we're hoping to replicate. This study in a male cohort as well. And we would like to look at how this ratio can be used to identify individuals at risk of muscle wasting disease, such maybe perhaps cachexia. And one particular population that it might be useful in is cancer cachexia as well, where we know that a lot of people with cancer suffer with massive muscle wasting. And if we're able to, like you said, develop some reference ranges over time with musculoskeletal disorders, then we essentially help clinicians who would otherwise not order a DEXA scan to assess muscle mass, to assess lean mass. If we allow them to use a biomarker that is commonly used to assess kidney function anyway. So in that sense, it's kind of like trying to kill two birds with one stone.
That's great. I'm looking forward to your following research results. So finally, I would like to ask you, what's your next plan for your life? I mean, for work or for your research or personally, think.
Personally, we've really developed this Institute of Nutrition Research at Edith Cowan University over the past 4 years, and we finally managed to get it funded for the next 5 years. So what I'd like to do is really continue with my leadership role in the Institute as a senior research fellow and develop a much larger team looking at the dietary components that affect musculoskeletal health and the interaction between the diet, the cardiovascular system, and the musculoskeletal system, especially in the space of fall and fracture prevention as well. I think we are a young institute. We've just started, but given another 3 or 4 years, I think we will become much larger and hopefully be even more successful as well.
Oh, that's nice. I hope you success in the future. And so thank you very much for taking your time to have this interview.
Thank you so much. Anytime, happy to help.
Yeah, thank you very much. I'm looking forward to your future research and the future your life. Thank you very much. Bye.